Hi, my name is Bonnie Brzozowski, and I'm a reference librarian at the Corvallis-Benton County Public Library. And I wanted to talk to you today about misinformation online, specifically related to COVID-19. The World Health Organization has called this time an infodemic. There's a lot of information out there. Some of it's accurate, a lot of it's not, going around about this disease. It's making it really hard to find trustworthy sources, and it's sort of breaking down the trust some people have on information in general that's coming from the internet. So if you have about 10 minutes, I'll just give you a quick overview, some quick things that you can look out for to help you try to prevent the spread of misinformation online and help you identify it more quickly. This quote stood out to me. The point of modern propaganda isn't only to misinform or push an agenda, it is to exhaust your critical thinking, to annihilate truth. It's difficult when it becomes difficult to discern between truth and fiction online, it frustrates many people and it makes them believe that just nothing is true. When people become distrustful of information online, that's pretty dangerous, especially at a time when we're needing so many people to pay attention. We don't want truth to be annihilated, so as considering all of us are actually publishers of information online because we have social media accounts, we share information with people online, we have to be sure that we're not sharing bad information. We need to share the best possible information now more than ever. We have to be really cautious. So this guide from Politifact is pretty helpful. Just a few quick strategies to sort of question what it is that you're seeing. Think about how you're consuming information online regarding COVID-19, but even to epidemics more broadly. Number one, learn the basics of the disease. Knowing things like what the symptoms are, that's going to make it easier to spot bad information. If you really understand what is known so far about the disease in terms of how it works and how it affects your body, and that's just going to make you a lot more likely and more capable of spotting bad information online. Be wary of claims about the epidemic's source. There's a lot of conspiracy theories around how the disease began, and at this point there's really nothing known. So all those conspiracy theories are baseless at this point. We don't really know the source of this epidemic, and it's going to take us time to find out. Verifying images and videos related to the epidemic is really important. Visuals are often out of context or misleading. Visual information is really easy to digest. It gets shared really easily because it stands out to people. So just be particularly wary of that kind of information related to COVID-19. Number 4, double check case numbers, death tolls, and fatality rates. That's always going to be changing, of course, but some people might manipulate those numbers. You need to make sure that you're getting those numbers from an accurate source. So, for example, the World Health Organization, is really probably the best source of that information, and they provide it via situation reports that they do daily, where they'll give you the number of people, a verified count of the number of people affected by the disease and by country. Beware of attempts to downplay or amplify the threat of the disease. This has already been politicized. The situation's already been politicized. People are going to look for scapegoats. People are going to look for ways to deflect blame. Just be on guard for that. Number 6, don't share prevention or treatment methods without consulting official sources. This is kind of the biggest category of misinformation that's been going around is related to prevention and treatment methods. The CDC and the WHO, Centers for Disease Control and Prevention, and the World Health Organization, those are the experts on this disease. They're the ones who who we need to be listening to regarding treatment, if there is any, which so far there hasn't been treatment. Number 7, look for what's still unknown. It's going to take us time to understand this disease. Scientists are doing research. They're working to learn more. So I think when there are a lot of unknowns, it's tempting to fill in those blanks or to look for people that are filling in those blanks. We really shouldn't do that. We kind of do have to exist in this world of unknowns at this time. We have to try to be comfortable and patient with the unknown. For now, it's gonna take them time to really understand this disease and figure out what's going on. So patience is important. So one of those strategies there was talks to or speaks to consulting the experts on the disease and making sure you're getting credible expert information. So if you go to this link here, that's a link to it's a collection of links to expert sources, lists of hoaxes and viral misinformation, and guides to debunking bad information. It includes some local links, so it includes the link to the Benton County, Oregon updates regarding coronavirus, as well as the City of Albany's updates. And then it also has a link to the Oregonians' coverage of the coronavirus, because they've been a pretty good source of news regarding coronavirus relating to the state. So take a look there. I think that you'll find some good information there. But also just to note too, if we are not being very conscious about the way that we're consuming information right now, that's going to make us more susceptible to misinformation. It's also going to wear on us in terms of our mental health. So deciding to only consult a few sources a day and perhaps only doing it once or twice a day is an optimal strategy at this point. It's gonna help save your emotional state to a certain extent, and it's also going to prevent the spread of a lot of bad information, because I think the more tired we are, and then the more all over the place the sources that we're consulting, just the more traps that we could potentially fall into in terms of bad information online. And I mean, with that said, I think I've already sort of alluded to this, and we really do have to check our emotions at this point when we're sharing information. A lot of information is sensationalized. I mean, headlines are sensationalized. Clicks are the new, or are the internet currency. So people want our clicks. People, from journalists with great integrity to trolls, want our clicks. So they're going to sensationalize things. We're going to see clickbait, and people want us to share things that seem outrageous. So because they want those clicks. So we really need to step back and say, hey, how is this making me feel? Perhaps that's making me not be in the most intellectual frame of mind possible, and thus I am not fact-checking this information. So here is an example of some bad information. This is not true. That was going around. This particular image has been used with different text to tell people about different supposed treatments and cures for coronavirus. This one being something like drinking water and gargling with certain items. And I think, so let's go ahead and just say that this is definitely false. If you read a little bit more about the virus, or you have, I'm sure you know that it's the virus works at a cellular level, and it gets into it invades your lungs and your lung cells. So a gargle or drinking water wouldn't really impact our lung cells. So it just can't be true. So that right there. Something else that we could note too is that it's not sourced in any way. So how do we fact check this? It's not even telling us where the source of this information. But regardless, I mean, if this were true, or if you saw this image and you were like, oh my gosh, perhaps this is true, I mean, how does that make you feel to think that this is true? I think it might have you experience two emotions: relief that the cure is easy, relief that a lot of people are going to have access to this cure, and then that relief might compel you to share it because you're like, why don't other people know this? I want them to feel the same relief that I feel. Shock, perhaps, because why isn't this information more widely known? Why don't people know this? I need to make sure to share it so everyone knows it. So just sort of an example of how emotion can kind of step in and compel you to share things out of compassion and not, you have no malintention, but it can harm someone if someone believes such things. That can be problematic, right? So sources for just this little presentation and things that you might want to consult if you want to explore this topic further. 5 quick ways we can all double check coronavirus information online is a great little guide. If you just have maybe like 5 to 7 minutes for that one, it's worth a look. It will give you some tools for checking information online. Web literacy for student fact checkers, that's a much more in-depth resource. It's a free ebook, but if you're interested in all things fact checking, check it out. You can browse it or read it beginning to end. The News Literacy Project has a coronavirus collection. It's it's just more links to ways to debunk misinformation online, and then misinformation that they have debunked and how they've debunked it, all regarding coronavirus. So check it out. So thanks for joining me so much. Really appreciate it. Check out these other videos regarding misinformation online. I hope they're useful to you. Thanks again.